Warm greetings to all. 14th November is World Diabetes Day, and on this day, it is very important that we create awareness about diabetes, its complications, and how preventive care can go a long way in helping diabetic patients keep up their good health. India is the diabetic capital of the world. World Health Organization states that 2% of Indians are diabetics and has projected it to be 57.5 million by 2025. Diabetes can be type 1, which is insulin dependent, and type 2, which is non insulin dependent. Type 1 diabetes is common in young individuals and is caused by reduced insulin secretion in the body, whereas type 2 occurs in older individuals and is due to reduced insulin utility. It's mostly because of sedentary lifestyle and unhealthy food habits. Diabetes affects all organs, including eyes, heart, kidneys, nervous system, brain, etc. Diabetics are twice at risk to develop eye problems as non diabetics, and the risk of blindness is 25 times higher in diabetic patients than non diabetic patients. After 20 years of diabetes, more than 75% of patients develop diabetic retinopathy, and it is more than 95% in type 1 diabetes. The incidence of cataract and glaucoma are higher in diabetic patients. Repeated lid infections and cranial nerve palsies are also commoner in diabetic patients. In diabetic retinopathy, the blood vessels in the retina become weak, the vessel wall swells out and starts leaking, causing bleeding with deposition of fatty material and swelling. Lack of blood supply to the retina deprives it of oxygen and nutrients, and hence there is stimulus for new vessels to develop, which are very weak and break down and bleed further, causing retinal bleeding all over. And in some cases, the bleeding may be profuse, causing drop in vision. This is called vitreous hemorrhage. This blood, when it clots and scars, will pull on the retina, causing tractional retinal detachment, which leads to maybe irreversible blindness as well. Diabetic retinopathy is usually symptomless until a lot of damage has occurred. Slight or intermittent blurring of vision can occur sometimes, and drop in vision happens only when there is heavy bleeding or when there is gross swelling in the central part, the macula, or when the scar tissue pulls on the retina, causing tractional retinal detachment, causing permanent sight loss. Diabetic retinopathy can be proliferative diabetic retinopathy, non-proliferative diabetic retinopathy, and maculopathy. It is the routine dilated examination of the fundus that will help us pick up diabetic retinopathy at an early stage. Also, investigations like optical coherence tomography, fundus fluorescent angiography, and B scan when there is totally blurred media due to heavy bleeding can all help in diagnosing diabetic retinopathy and stage it for proper treatment. When there is maculopathy and proliferative diabetic retinopathy, the vascular endothelial growth factor is thought to be the cause, and injecting intravitreal anti-VEGF agents have proven to be very useful in controlling the bleeding, edema, and improving sight. Laser treatment helps in converting the hypoxic peripheral retina into anoxic retina, which will in turn reduce the new vessel formation and hence the bleeding. Please remember, laser may sometimes improve vision in some cases, but is done mainly to prevent permanent loss of sight. Surgical treatment may be needed only in cases where there is heavy bleeding, and pars plana vitrectomy is a procedure where the blood in the vitreous cavity is cleared using a vitreous cutter through a small hole, and sometimes silicone oil or gas can be injected into the vitreous cavity to arrest the bleeding, and even lasers can be used for this purpose. Diabetics need an annual checkup. If diabetic retinopathy has set in, more frequent checkup may be needed. Good control of diabetes by diet, exercise, and medications is important. Early detection and timely treatment with intravitreal injections, laser, or in some cases surgery can prevent irreversible blindness due to diabetes. Control of associated problems like hypertension and cardiac problem is very essential. Prevention is better than cure. Thank you.